You'll recall the heartbreaking story of two Soweto boys whose mutilated bodies were discovered last week in Rockville and White City. It continues to grab the headlines, with the suspects set to make their second appearance in the Protea Magistrates Court on Friday. 5-year-old Nqobizitha Zulu and 6-year-old Rabanye were killed and mutilated in what's alleged to be another Muti ritual. Let's now look at how such violence and trauma against children affects young people and how parents can help debrief their children. Let's expand on this topic with clinical psychologist Joanna Kleovoulou, who joins us now to make sense of a very difficult topic. A very good evening to you. Thank you so much for your time. I mean, the story itself grabbed headlines and sent shockwaves across not only the community, I suppose the country at large. How does one now communicate the shock that's already traumatizing adults to children?
Sure. I think it's actually useful and important to know that this information needs to be out there. It's a shocking, grotesque, non-negotiable murder that touches violence, touches vulnerable children and the helpless. This should not happen to any society, and it's a mirror for me about what we as a human race are desensitized to. So I'm actually grateful that it's out in the news and it's taken headlines. And yes, so many kids are so susceptible to information out there. So whether they're listening to the news, whether they're hearing parents chatting in the dining room, or whether they're hearing it over the news whilst driving to school, children have been touched by the violent society that we're living in. I see it in our practice, often children coming to our rooms with post-traumatic stress disorder, separation anxiety, fear of not wanting to go to school, so school truancy, academic decline, and really sometimes violent acting out behavior. So this has really a profound ripple effect on not only us as a society, but onto our children as well, and should not happen.
So with all the information that's out there, how does a parent now try and explain what death is, irrespective now of how traumatic and how brutal this instance was with the two children in Soweto?
So I think it's really important to help children understand that death is actually a very natural process of life, and it's the cycle of life. And under normal human development, that this occurrence does happen. You often find children at the ages of 4 years old quite contemplative about the concept of death, although they don't understand the permanency of it. So they'll often have a pet that's died, or they'll be investigating and curious about little animals or creatures out there, a butterfly that's died in the garden. They might have their gogo or their grandparents having passed away, or a family friend's parents. So they become conscious of the concept of death around the ages of 4 and 5, and they generally do ask those questions. But they don't understand that it's permanent, and they often think that if they do something useful, like if I pray enough, if I behave well enough, if I help my parents do X, Y, Z with the chores, perhaps that person will come back. I had a case of a parent that unfortunately passed away due to COVID, and mum was experiencing constipation, and the child came to me for play therapy to deal with the loss of mum. And in her playing, she was fixated in the therapeutic process around giving mommy medicine to help her get diarrhea. So often children get fixated with certain behaviors. They have regressive type of behaviors, and it really does show up depending on the age and stage. So explaining death to children is a normal occurrence, and we shouldn't be afraid to talk about it in a very natural and calm way. And we need to be approachable parents.
Mm. In this
but
instance,
when it comes to something, yes.
Okay, no, go ahead.
So in this instance where it's grotesque, it's gruesome, it's violent, children often don't get the true understanding of what murder is. And I think it really is important when the child approaches you with this type of information, or they're acting out in some sort of way, or they're behaving in an anxious way, they're retreating. It's really important to be that approachable parent where you can be attuned to your child and find a calm, safe space to then ask them, what were you thinking? What did you mean by that child was murdered? What does murder mean? What does mutilation mean? So it's really important to be attuned to your child and to be attuned to their behavior and the change in their behavior. To find an opportunity to explain to them in a very direct and calm way, but depending on their age, what a crime is and what murder is. And ultimately, us as parents and custodians, as adults, we need to take care of our children and keep them safe.
And very quickly, in being an approachable parent, how then do you explain what murder is without instilling fear and uncertainty within the child?
So it's really important to have a home where there's a calm, secure space where a child already doesn't understand what violence is in the home. So it's really important for a child to understand that it's safe and secure, and it's my parents' job to make me feel loved and comforted and safe, and that this world is a safe place. Research shows that children under ages of 7 shouldn't be exposed to violence on TV, violence in the home, and violence in society. So if we can keep it very basic and limit any type of violence exposure to the child, that would be pertinent from 7 years and under. But unfortunately, we are living in a very violent society. Here in South Africa, from the time in June last year to June 2021 to June 2022, 1 in 188 murders were children. So we cannot deny that fact. You know, our children are living in, fear. They cannot go and play outside and ride bicycles anymore. So we need to ensure that we explain to our children that as parents and as caregivers, we need to keep them safe. And these are the things that we do to stay safe. We need to identify with them who the people are that they can go to when they're feeling uncertain, unsafe, and have got this gut feeling that they're not comfortable, so that they know they've got trusting adults they can go to. And as they get older, it's important to explain to them that murdering somebody else and taking their life, stopping their hearts, their brain's not working, the body doesn't function anymore, means that it's a criminal offense. They can go to jail, and there are major consequences for violent acts. And starting off with teaching them how to acknowledge difficult feelings, to understand that, for example, anger is a very natural emotion, but not to internalize it, which causes depression, and not to externalize it, where it causes aggression and violence. So it's really important as a microcosm, which is the family system, is to demonstrate what it means to acknowledge feeling, to have a safe, warm, comforting, nourishing environment where the child can really feel validated and cared for, and that any forms of acting out behavior can be contained, and give them coping skills in a healthier way to express, rather than act out in a way that's violent and aggressive and harmful.
Absolutely. Thank you so much for some insight.